Hello, today's video is entitled God's Battle Plan for Youthfulness. I'm Dr. Victor Chen. This is the number 7th topic in God's Battle Plan series. Okay, what is youthfulness? It is defined as a behavior or appearance characteristic of young people. So note two things. Behavior, that means how you behave, your mindset, and secondly, appearance. So youthfulness is not just about your chronological age, it's about vitality. I mean, some people can be young but lack vitality, right? Your spirit to live, to thrive, and your physical body renewal. God provides a divine strategy to sustain our strength and inner joy. He satisfies your desires with good things so that your youth is renewed like the eagle. Okay, the enemies of youthfulness: stress kills, sin and worldly distractions drains vitality. Okay, if you're worried, you're stressed, you become tired. So negative thoughts and unhealthy habits accelerate aging of the body and our spirit. Is outward appearance important? Yes, because the Bible in 1 Samuel 16:7 says that the Lord looks at people's heart, right? But people look at the outward appearance. I mean, you go for a job interview, whether it's at a corporate job or you want to go for a Asia interview, they look at your appearance, right? Your height, etc. How good is your skin, etc. So people look at the outward appearance. So therefore outward appearance is important. Beauty is now entering its most innovative era. Are the days an era of the filler and Botox over? We will discuss it later. Long-term collagen stimulation over volumizing fillers. Okay. Now the trend is that people want something that is lasting. You know, they know that collagen is like the foundation, not just simply putting in fillers and so forth and collagen, right? They want something that's lasting. So you got emerging treatments like Sculptra, okay, Harmony CA, and the shift is towards regenerative aesthetics, not just masking aging, but to regenerate. Okay, so you got exosomes and secretome skin treatments and injections, surgery like blepharoplasty, double eyelid, eye bag removal, liposuction, facelifts, buccal fat removal, jawline surgery. And for weight loss, you have peptides like Ozempic, right? Semaglutide, Lipofast. You have cryo lipolysis. That's what they call it, freezing your fat. Okay. The trends in the aesthetics and beauty and what they call EMA. Okay. Patients are moving away from surface level tweaks and obvious results like a quick Botox, a quick filler. And instead are arriving for their consultations armed with better questions about structure, regeneration, downtime, and what it will look like, the outcome, okay? And these days with AI, you can do an AI imagery of what the outcome can be. So skin architecture is going mainstream, okay? Not just superficial, but the skin architecture. Like some of the new treatment include Ultra Clear, it's laser. It's the world's first co-ablative fractional fiber laser designed to resurface the skin, reduce wrinkles, and to treat acne scars with minimal downtime. It stimulates collagen and elastin by creating controlled microscopic channels suitable for all skin types, including darker tones. Each treatment takes about 20 to 45 minutes, offering faster, comfortable, and visible rejuvenating results. Okay. 6 modes in one device. It clears improve your skin texture, clear the sunspots, and prejuvenation. Prejuvenation means looking for early signs of skin aging, and then you treat it. Okay, it's similar to rejuvenation. Clear the discoloration, age spots, and sun damage. Treat scars, acne scars, and the fine lines. helps clear the wrinkles, and it helps in collagen remodeling of the skin. Laser coring, for the deep wrinkles and the effects of gravity, which is like sagging, right? And surgical for deep scarring. Ool therapy. Ool therapy is a non-invasive, FDA-cleared procedure that uses microfocus ultrasound, to lift and tighten skin on the face, the neck, and the colletage, which means the lower neckline in the women, by stimulating a natural collagen production. It is a non-surgical alternative for treating mild to moderate skin laxity with no downtime, with results that typically last 1 to 2 years. And what's the difference between Ool therapy and older treatments like HIFU, high intensity focused ultrasound? There's more precision, less downtime. In fact, there's no downtime needed for Ool therapy. It penetrates deeper to the skin. The results are progressive and they last much longer compared to HIFU. Morpheus 8. Morpheus 8 is a non-surgical, minimally invasive, combining micro-needling. Okay, minimal invasive because, see the probe here, they are micro needles, small needles, with radio frequency energy to remodel, tighten, and contour the face and body by targeting deeper skin layers to stimulate collagen and elastin. It reduces wrinkles, sagging skin, acne scars, and fat deposits with minimal downtime. Sculptra is an FDA-approved injectable collagen stimulator made of a poly-L-lactic acid that gradually restores skin firmness, structure, and volume over time. Unlike fillers, it stimulates natural collagen production to treat sagging skin and wrinkles, with results lasting over 2 years. And it requires 2 to 3 sessions and is ideal for natural rejuvenation. Profilo Structura is an advanced injectable regenerative medicine treatment designed to restore lost facial adipose tissue. Sometimes people are like sunken in, improving skin firmness and lifting sagging in the lower face and cheeks. It uses a NACO technology to target subcutaneous tissue, offering a more contoured natural lipo-lifting effect than traditional fillers. Polynucleotide injectables. Polynucleotide injectables are innovative, regenerative biostimulators derived from purified fish, salmon DNA that stimulates collagen, increases skin elasticity, and reduces the fine lines. Acting as a tissue repair agent, they enhance skin quality and hydration, particularly popular for under eye, neck, and facial rejuvenation. Regenerative treatments are replacing traditional Botox and fillers. Because Botox and fillers, they mask aging, they don't regenerate, but they still have a role. People are now more interested in regenerative treatments. People are opting for regenerative treatments and investing more in their skin health rather than Botox and fillers. Why traditional aesthetic treatments have limitations? There's no doubt that Botox and fillers can be effective. They work quick and minimally invasive and can smooth out deep wrinkles, lift tired features, restore lost volume. But these treatments come with some limitations. They don't heal the skin. Botox paralyzes the muscle. Fillers replace lost volume. Neither one actively stimulates your body to repair or build tissue. They require repeat treatments. The effects are temporal, lasting anywhere from 3 to 12 months. Over time, maintenance becomes more frequent and results may diminish if underlying skin quality isn't addressed. They don't improve your skin health. Wrinkles, sagging, and dullness aren't just about aging muscles. They are about collagen loss, oxidative damage, mitochondrial dysfunction, and tissue breakdown. Injectables don't reverse this. Risk of overuse or distortion. I mean, overfilled cheeks, frozen expressions, and unnatural contours can result when injectables are used as a blanket solution for all aging concerns. While regenerations offers more than just aesthetics, while Botox and fillers offer cosmetic results, regenerative treatments offer health and vitality. Here's why regenerative aesthetics should be the new standard. It stimulates natural collagen. Okay, collagen loss starts in our 20s and accelerates each decade. Regenerative treatments rebuild collagen from within, giving firmer, plumper skin naturally. Supports skin longevity. Aging isn't just about appearance, it's about function. Regenerative therapies improve circulation, oxygenation, and cellular energy, extending the life and quality of our skin. Reduces dependence on injectables. When your skin is healthier and more resilient, you need less fillers, less Botox, and fewer touch-ups, and results will look more natural and last longer. Enhances overall healing. Post-procedure recovery is faster and more effective when regenerative support like PRP, plasma-rich platelets, exosomes, or red light therapy is included. Aligns with holistic wellness, right? It's natural. Patients today want more than quick fixes. They want treatments that fit their values of natural health, anti-aging, and vitality. Regenerative aesthetics bridges the gap between cosmetics and functional medicine. Are Botox and fillers still useful? Yes, absolutely. When used strategically, in many cases, Botox and fillers enhance and complement regenerative approaches. For example, Botox can soften dynamic wrinkles while PRP improves skin tone. Fillers can restore structure while microneedling builds collagen. Regenerative treatments can extend the life and quality of injectables. The key is to shift from a filler-first mindset to a regeneration-first philosophy, prioritizing skin health and natural repair. Exoskin, I've had exosomes on my skin regularly. Regenerative aesthetic treatments using stem cell-derived vesicles to stimulate cellular repair, collagen production, and tissue rejuvenation. They address wrinkles, sagging, acne scars, and pigmentation, often paired with microneedling for maximal absorption. Yeah, that's what is done for me. Microneedling the exosome into the skin. Benefits includes faster healing, reduced inflammation, and a brighter and firmer skin. Okay, XOI. Exosome eye treatments are cutting-edge regenerative approach to eye area rejuvenation. That means eye area, typically used to address signs of aging rather than internal eye disease. Okay, it's not for in the eyes, it's the skin around the eye, the eyelids. And this is actually a picture of me. This is the same day. This is just before I had the exosome eye treatment. They use microneedling. Okay, see, it's puffy here. But after just the first treatment, see, look less puffy under the eyes, and even this left upper eyelid is more prominent. Okay, unlike traditional fillers, exosome therapy uses extracellular vesicles to encourage cell repair and collagen synthesis. So it's also microneedled into the eye. And okay, other procedures that men are going for, increasingly popular, I've gone for it a few times, is the P shot, the Priapus shot. It will boost men's sexual performance naturally, okay, enhance your stamina and vitality, improve sensitivity and satisfaction, and it's drug-free and the results are lasting. I can testify to that. So the P shot or Priapus shot is a non-surgical procedure injecting a patient's own platelet-rich plasma into the penis to improve sexual function, sexual performance, and to treat erectile dysfunction. Here you go. Your PRP, your patient's own PRP is injected into the penis. The 30-minute procedure uses growth factors to stimulate tissue repair, with results typically appearing in 3 to 6 weeks. And in my case, I added secretome with the PRP for extra effectiveness. And not only that your performance increases, your male member, the size will increase as well.
This needle is about to go into a patient's penis. This is a P-shot of PRP, and I'll take 20 seconds to explain to you why we're doing it today. Doing plasma injections to a penis helps to increase blood flow, which increases blood vessels, which increases girth and erections and sensitivities. Now, it's not going to give you the hardness like Viagra or these other medicines do, but this is the natural way to do it. If you have any questions about P-shots, let me know, because I do these every single day.
O shot is the one for female, or O stands for orgasm shot. Okay, the O shot is a non-surgical under 30-minute procedure using a patient's own PRP to rejuvenate vaginal and clitoral tissue. Okay, it aims to increase sexual sensitivity, improve arousal and orgasm intensity, to boost the lubrication and alleviate mild stress urinary incontinence by stimulating the stem cells. So you go. You inject it to the vagina, to the areas here, okay, to the clitoris tissue.
Super easy. So again, if you are interested in the O shot, come on in and see us.
For pigmentation, I've had frequent pico laser treatments to remove my pigmentation, especially I was cycling a lot and result in a lot of UV exposure. There's Frexel laser, there's Q-switch, and there's an ND-YAG laser as well. So, I mean, they all have its own merits.
Hey beauty enthusiasts. Today I'm diving into how AI is revolutionizing the world of aesthetic medicine. Buckle up, because the future of beauty is here, and it's all about personalization and precision. First up, AI-driven diagnostics and assessment. Imagine advanced imaging that captures every detail of your skin texture, facial structure, and even bone density. AI analyzes this data to spot early signs of aging or minor asymmetries. Plus, it can look at your genetic info to predict how you'll react to treatments. Next, customized treatment planning. AI uses data from countless procedures to recommend the perfect plan just for you. It can suggest the ideal Botox dosage, filler placement, or laser settings. And you get to visualize the results before anything happens, thanks to real-time simulation. For non-surgical procedures, AI ensures precision. It determines the best intensity, duration, and frequency for treatments like laser therapy or chemical peels, minimizing risks and maximizing results. When it comes to surgery, AI takes it to the next level with 3D modeling and custom implants. It helps design the perfect nose for rhinoplasty or plan intricate surgeries with robotic assistance, offering real-time feedback to surgeons. During procedures, AI provides real-time adjustments. For surgeries, it suggests incision tweaks based on live data. For non-surgical treatments, it adapts the intensity based on your skin's response. Post-treatment AI generates personalized recovery plans tailored to your healing process. It even designs long-term maintenance plans to keep you looking fabulous over time. AI empowers you to make informed decisions with detailed treatment options and transparent AI-driven recommendations. The continuous learning and integration with broader healthcare data make AI an ever-evolving tool in aesthetic medicine. So, there you have it. AI is transforming the way we approach beauty, making treatments more personalized, precise, and ultimately more satisfying. Stay tuned for more insights into the future of aesthetic medicine. Don't forget to like, subscribe, and hit the bell icon for more beauty tech updates. Catch you in the next video.
So, in summary, AI is transforming aesthetic treatments by enabling hyper-personalized care, enhancing diagnostic precision. Like you can even have an AI generate image of what your procedure will look like and end up like, right? And predicting outcomes, moving the industry towards data-driven, safer, and more efficient procedures. Key roles include AI-driven skin analysis, virtual simulations, smart laser technologies, and robotic-assisted procedures. Jawline contouring. Everyone just wants a sharp V face. Okay. Besides surgery, you can go to Korea, or you can do. Jawline contouring defines the lower face by enhancing the jawline through non-surgical methods like fillers, specialized fillers, Juvederm Voluma, or you can do Botox to tighten the masseter muscles, the biting muscles, make it slim, or threads. Okay, the natural sort of string. These procedures add definition to the face, reduce jowls. Jowls means sagging skin in the lower jawline, and sharpen the profile with minimal downtime and immediate, long-lasting results. That is PDO threads, strings.
PDO thread is a type of dissolvable suture that's actually made even from a sugar, and it dissolves underneath your skin over time, and everywhere where a thread is placed does create a little bit of collagen and a little bit of fibrosis, so that over time, as you do more threads, the tissues can stay more lifted. So here today, we're actually going to be doing PDO threads on our lovely patient, Charlene. So Charlene's concern is, and her genetics of aging is basically jowling and some amount of facial sagging here. So the style of numbing that we do here is more of a tumescent numbing, where we're putting numbing under the skin, not topical numbing. That's a really big difference that you might want to ask your provider about. And so that will work immediately. It'll be more effective and last around an hour. So this was the actual painful part of the procedure. She's feeling a little bit of stinging, and so what we're doing is we're using our kinetic vibration tool so that she's comfortable, and then she also is using nitrous, which is laughing gas, so that she's not in pain. So we offer two types of thread techniques, and one is called scalp fixation and one is non-scalp fixation. The scalp fixation uses a hook and is a thicker thread that will go deeper for more deep attachment. That type will last anywhere from 3 to 6 months and longer, depending on how many threads we put, and also depending on the quality of your fascia and your age. And then the non-scalp fixation will last anywhere from 2 to 3 months, depending on how many threads you use, quality of your scalp skin, and also your age. So we're making the entry poke to place the thread first. So there's different techniques for placing threads. This cannula is a non-threaded cannula. You see there's nothing in there. That's important because if I want to reposition the cannula so that I have the best position of the thread, I can. If you have cannulas where the thread is already positioned, sometimes you can't reposition the thread. And we're now going to put the thread inside the cannula. We use Mint brand threads, which is an important part of having a good result because the thread is a molded barbed thread. What that means is that they did not cut the barbs into the thread to make it hook. And so you have a thread that is less likely to break. So in terms of the depths of the thread, we actually don't want the threads very deep. They're going to be in a specific layer of the tissue where they're hooking on to the fat, and that's how it allows it to pull up on the skin. If we're in that layer of tissue, that's also how we can avoid bunching and also visibly seeing the thread. So someone who's a poor candidate for threads is someone whose skin is too loose. Because what will happen is the thread will go in, it'll look good for a few days, and then the skin will go back to where it was. So what you're seeing today is a really perfect entry-level threads experience for someone who's in their 20s, I'd say even to early 40s. Where this might not be a really good entry-level experience of not using the hook is if someone is much older and their tissue is much laxer. We would want to just start with using the scalp fixation hook so that they actually have a treatment result. So our next step is we're going to tie the threads together so that they stay anchored, and they're going to basically, it's going to give her a little bit more support and results. So what PDO threads can't do is they can't give you a new face. They're not going to change your natural anatomy to something that's totally different than what you were born with. What they can do, however, is help prevent sagging and help restore your own natural anatomy to where it used to be. So if you were to do threads and do them once and never do them again, your tissues will return to where they were at previously, and it won't be visible to your eye because it's only one treatment, but you still will have benefit from that one treatment because you will form collagen and fibrosis around each thread that was placed.
Okay. Lifting is on the agenda because with time we give in to gravity, our skin will sag. So there are other treatments like Thermage, Genius radiofrequency, and Endolift, all of which focus on collagen stimulation and elasticity rather than having big volumes with like fillers, right? Thermage uses radiofrequency for deep, widespread tightening. Genius RF combines microneedling with radiofrequency for precise dermal regeneration. And Endolift uses laser energy for deep skin lifting. So there are many to choose from. So hormonal and age-specific care, menopausal and perimenopausal treatment. Because why? Once you lose the estrogen, your skin is going to get, you're going to lose collagen, right? So you can consider, bioidentical hormones, etc. Tailored protocols to address thinning skin, dryness, and volume loss in women 40 to 50 years old and beyond. Male aesthetic procedures, there's more, aesthetic procedures are being popular more and more in males, including people like me. Rising demand for subtle anti-aging treatments amongst men, including jawline contouring and hair restoration. Hair transplantation. A hair transplant is a surgical procedure that relocates hair follicles from a dense donor area, usually the back of your head, okay, or the side, to thinning bald areas, usually your crown and your frontal area. Using FUE, individual extraction, or FUT, which is strip harvesting, techniques under local anesthesia, it offers permanent, natural-looking results for male pattern baldness. Recovery includes minor swelling and discomfort, with full results visible in 6 to 12 months.
A hair transplant begins with the doctor carefully extracting hair follicles from the back of your head. These follicles, each containing a few hairs, are removed by a circular surgical punch to cut around each hair follicle individually. They are then meticulously implanted into the balding areas. Each follicle is placed to match your hair's natural growth direction. Over time, they adapt to their new location and start growing.
Okay, blepharoplasty. Blepharoplasty restores a youthful, rested appearance by removing excess skin, fat, and sagging muscles from the eyelids. There you go. You see, it's all the fat here, the fat and the sagging skin is removed. So you can do both your upper and your lower eyelids, depending on your current your skin situation. This procedure, commonly known as eyelid surgery, corrects droopy eyelids and under eye bags that create a tired or aged look. It results in a brighter, more alert gaze and improved facial harmony. So you can do upper or lower or both eyelids. Okay. Cryolipolysis, commonly known as fat freezing or cool sculpting, is a non-invasive FDA-cleared cosmetic procedure that uses controlled cooling to destroy fat cells, reducing localized fat bulges by roughly 20 to 80%. It is clinically proven. So and FDA approved. So you can do it on your tummy or your under your neck, wherever the fat bulges. It's ideal for stubborn areas like the abdomen, the thighs, the chin, and with results appearing over 2 to 4 months.
You exercise, you eat right, you do everything you can to look and feel your best. The sad truth is, sometimes that just isn't enough. Most of us form stubborn areas of excess fat. You know, that muffin top, or those love handles, bulges that are immune to diet and exercise. So your jeans don't fit, your little black dress is too little, and your mojo is MIA. But now there is something you can do to get rid of the bulges that are keeping you from feeling your best. Cool Sculpting is a revolutionary new contouring treatment that uses the power of cooling to eliminate stubborn fat the safe, non-surgical way. Developed by Harvard scientists, this contouring treatment is FDA cleared for fat reduction with proven results seen in clinical studies. So how does Cool Sculpting work? It all begins with a consultation where you and your doctor will assess your problem areas and create a treatment plan based on your goals and realistic expectations. Then you'll book an appointment to lose that stubborn fat. On your Cool Sculpting treatment day, you should arrive wearing loose, comfortable clothing. The technician will apply a gel pad to protect your skin. Then the applicator delivers vacuum pressure and cooling to the targeted site. As the applicator pulls the bulge into the cooling panels, you will feel a firm tug and pinching and intense cold. There may initially be some tingling, but this typically subsides as the area gets numb. The fat cells are targeted and cooled, triggering their natural death. And because fat is more sensitive to cold, surrounding tissue and muscles are not affected. Over the course of the next few weeks, your body begins to naturally eliminate the dead fat cells. As the fat cells are eliminated, the remaining cells condense, resulting in an overall reduction of the fat layer. Depending on your personalized plan and goals, your treatment may last from 1 to 3 hours. When you're finished, you can return to your normal activities, including your workout routine. Some side effects may occur, including bruising and redness, numbness, soreness, or tingling, but they are only temporary. In the weeks and months that follow, you will see an undeniable reduction of fat, and as long as you maintain your healthy lifestyle, the treated fat cells won't come back. In your follow-up visit, your doctor will take after photos so you can really see how effective your Cool Sculpting treatment was. You and your doctor will assess your results to determine if you would like to have another treatment on the same area or treat other problem areas. Best of all, your clothes and your confidence will be exactly where you want them. Your little black dress will fit just right. You'll make peace with your two-piece. Your physique in that t-shirt will turn heads again. And those jeans won't be topped off with unwanted bulges of fat. You have the power to...
Okay, the next is buccal fat removal. Huh? Again, it's aesthetic because some people have like chubby cheeks. And you got to go inside and remove the fat that's here. So they have a slimmer cheeks. And there you go, the fat. So, buccal fat removal is a 30 to 60 minute surgical procedure that permanently slims the lower cheeks by removing the fat pads through small inside the mouth incisions. It's ideal for candidates with full round cheeks seeking a more sculpted defined jawline, and cheekbones. Right? This procedure generally requires a 3-week recovery period. Okay, so these are all these modern procedures. Look at some basic things we must do to stay youthful. Okay, 1, stay out of the sun, drink plenty of water, get enough sleep, rub it in, your moisturizer, all kind of things, your eye cream, eat a diet rich in plants, okay, because lots of antioxidants in plants and fruits. Get moving, exercise, manage stress, because stress kills and makes you age faster, and limit alcohol and caffeine and smoking. Apply a broad spectrum SPF 30 plus daily to guard against UV induced collagen damage, even on cloudy days, because even indoors, the lighting or that can cause photo aging. Hydration is key. And if you ever wonder how some people manage to maintain their youthful glow well into their 60s, hydration plays an important part. Regularly drinking water not only nourishes your body, but also helps your skin looking fresh and radiant. It's a simple yet often overlooked daily habit that can contribute massively to your appearance. Just simple water will do. How much water per day? Depends on a lot of things, right? And from person to person, whether you're exercising, whether in a cold weather country or hot weather country. For adults, the general recommendation from the US National Academies of Science, Engineering and Medicine is about 11.5 cups, 2.7 liters a day for women. And for men, it's 15.5 cups or 3.7 liters a day for men. And this includes all the water you drink, from beverages, teas, and the food. Basically, you get about average of 20% of your water from the foods you eat. And you might need more water than someone, depending on the climate you live in. That's very obvious. Sleep is important. People who maintain their youthfulness as they age understand the importance of a good night's sleep. They create an environment conducive for restful sleep and follow a constant bedtime schedule. Sleep isn't just about recharging your batteries. It's also when our bodies go into repair mode, tackling everything from damaged cells to imbalances in our hormones. When it comes to skin health and managing a youthful appearance, sleep is an absolute game changer. When we sleep, the brain gets a break from constant absorbing, analyzing, storing, and retrieving information. It commits information we receive during the day to memory. And it oversees the repair jobs that the body is doing while we sleep. I mean, like if you go to a gym, there's wear and tear, there's microfiber damage, but it's overnight when the growth hormone is released. When you sleep, then all this muscle repair, cell repair occurs. Our body releases hormones that helps in the regeneration of cells. All the wear and tear that we suffered during the day is healed throughout the night. The muscles get to rest and grow. There you go. The brain, when you sleep, the brain is busy at night clearing out the toxins, making connections and processing memory. Your lungs slows down and during your sleep it becomes more regular. Your muscles, your body releases growth hormones to repair the muscles, and to grow it. Your heart rate and blood pressure lower when you're asleep, which gives your heart a break. Okay, what are the hormones that are released when you are asleep? Growth hormone is released, from your pituitary gland, and then this helps repair your tissues and your muscles. ADH, antidiuretic hormone, so you don't have to keep peeing at night. Melatonin is released when it gets dark, so it'll help you sleep. The brain flushes out the toxin during our sleep. There are billions of cells in the brain. During the day, toxins are released from cells and slowly build up around the cells. This is why at the end of the day, we feel mentally exhausted. Our brain power is reduced after a long, hectic day. When we sleep, the channels of cerebral fluid expands, allow the toxins to be flushed out from the brain, right? So when we wake up in the morning, we feel completely refreshed and ready for the day ahead. The nightly detoxification of the brain not only helps in improving brain function on a day-to-day basis, but can prevent diseases such as Alzheimer's, certain brain toxins have been linked to Alzheimer's, are also flushed out during sleep. A study has shown that sleeping on your side leads to maximum efficiency in flushing out these toxins by the glymphatic system. So this is your glymphatic system. It drains out the toxins that's accumulated in your brain during the day, right? Skincare, apply it. It's important sunblock is important throughout the day. Eye cream, your toner, okay? And make sure you moisturize your skin enough. Use products containing active ingredients like retinol and vitamin C to boost collagen and promote cell turnover. Sunscreen is important as well as moisturizers. 5th, nutrient-rich diet. Consume a diet high in antioxidants, colorful fruits, vegetables, and healthy fats to support skin health from within. Regular exercise is important. Aerobic exercise for your heart. Strength exercise, okay? But you need to build muscle, okay? More muscle tissue you have, the higher metabolic rate, okay? And flexibility, stretch, I do my squats, like my grandmother, those primal squats, Asian squats. And so you stretch so you don't get, frozen shoulder, trigger figure down the road as you. Chronic stress accelerates biological aging in young people by increasing cortisol, which breaks down collagen, triggers inflammation, and causes premature wrinkles, dullness, and skin barrier damage. It often leads to accelerated skin aging, acne flare-up, and a young, old feeling, where high stress level makes individual feel emotionally and physically older. So practice mindfulness, your meditation, prayer, trusting in God, okay, to reduce the cortisol levels, which helps prevent inflammation and keeps you calm and reduce your aging signs in the skin. Limit alcohol and smoking and caffeine. Smoking breaks down collagen while excessive alcohol dehydrates the skin. Cutting back reduces cellular damage and aging. Lifestyle of youthfulness. Blessed is the man whose delight is the law of God. Okay, you delight in the things of God, His ways, His word. He shall be like a tree planted by the streams of water. Psalms 1. Be grateful to God, right? Grateful for the things we have. Don't complain about things we didn't have. And keep faith in the Spirit. Keep the spirit fresh. Healthy stewardship of the body, diet, rest, and exercise. And serving others keeps the heart young. Because why? The focus is not on you, me, but it's on the community as large, how we can help your family, how we can help others and friends. So thank you for listening.